Avian reovirus, so the occurrence is worldwide. For the etiology, you have the Spina reoviridae, which has the Orthoreovirus genus, which has the avian orthoreovirus. The Spina reoviridae is a 10 genome segment, and the avian orthoreovirus has 11 serotypes. For the epidemiology, it's resistant in the environment. It is shed through the feces and the discharge. There are trypsin-resistant strains and trypsin-sensitive strains. The trypsin-resistant strains enter the body orally and they cause enteric disease. The trypsin-sensitive strains enter the body through an aerogenic infection or transcutaneous, and they're more severe. It mainly infects chickens, but it can also infect turkeys, pheasants, quail, and peacock. And germinative infection can occur, and this is very important. For the pathogenesis, the virus can enter the body through an oral uptake, and the primary replication happens in the enterocytes of the small intestine and the cecum, as well as the bursa fabrici, and then viremia occurs, and then the secondary replication happens in the joints, the tendon sheets, and the visceral organs. There are 3 clinical forms of the virus. The first is tenosynovitis and arthritis, the second is the generalized form, and the third is the runting and stunting syndrome and the pult, enteritis, and mortality syndrome. Tenosynovitis and arthritis is the most important. The clinical signs are an enlarged knee and tarsometatarsal joint. The joints become warm and painful, so the birds become lame. They also get deformed toes, so their toes curl inwards, and they can get a rupture of the gastrocnemius tendon, and they get hemorrhages in their hock joint. In broilers around 4 to 8 weeks old, they have decreased body weight gain. For the pathology, we can see enlarged joints, synovitis, arthritis, and erosions of the synovia. We can also see fibrin in the joints and synovial cell hypertrophy and hyperplasia. For the diagnosis, do viral isolation. It's very important to know the strain. The virus can be isolated in an embryonic egg, or in the chicken liver cell culture, or in the foot pad of a chicken. For the diagnosis, do real-time quantitative PCR and viral neutralization and ELISA. And to prevent it, have good hygiene. It normally occurs when there's poor keeping conditions. And for the vaccine, there's an attenuated vaccine at 5 to 7 weeks old, and you give an inactivated vaccine in layer hens. This is because of the germinative infection. If you gave an attenuated vaccine, it would make the embryo infected. The second form of the disease is the generalized form. It causes enteritis and respiratory problems. The clinical signs are fever, diarrhea, and general clinical signs. In the pathology, we can see necrosis, inflammation, and degeneration of the visceral organs. And due to the immunosuppression, it also affects the spleen and the thymus, and the liver and the pancreas as well. We can see hypopericardium in chickens, as well as with the adenovirus. The third form of the disease is the runting-stunting syndrome and the pult, enteritis, and mortality syndrome. It's found together with adenovirus, parvovirus, astrovirus, and coronavirus. It causes diarrhea and enteritis. And it causes feather and bone development problems. And the feather problems cause helicopter disease. And the pult, enteritis, and mortality syndrome affects turkeys. The generalized form and the runting-stunting syndrome and pult, enteritis, and mortality syndrome are prevented by good hygiene and inactivated vaccines.